Some of the most urgent businesses on the African continent aren't just about profits, they are about survival. In many parts of sub-Saharan Africa, it's often one doctor for 5 to 10,000 people. This means that entire villages or counties rely on a few overworked professionals. Today I want to introduce you to 5 different healthcare startups on the African continent that are building the bridge between life and death. My name is Marvin, and 2 years ago I moved from Germany to Nairobi in Kenya, and ever since I've been exploring life, business and what really shapes the future of the African continent. The first startup that is saving lives here on the African continent is called LifeBank. They deliver essential medical supplies where they are needed and when they are needed. In many hospitals, patients die not because the medicine does not exist, but because it doesn't arrive in time. And LifeBank solves that last mile crisis. Sometimes there are no ambulances available, the roads are flooded, or you just have a poor infrastructure. They use boats, drones, motorbikes, whatever is needed and whatever it takes to deliver the medical goods on time. They are operating in Nigeria, Kenya and Ethiopia, save thousands of lives and work with thousands of hospitals together in rural areas. They do nothing flashy, but they do what's necessary to save lives when it's needed. From delivering the medicine, let's talk about making the medicine actually affordable, because this is also a big problem that sometimes medications are very expensive and many people cannot afford them. M-Pharma saw exactly this problem. African pharmacies suffer often from chaotic supply chains and very high prices. One drug might cost in one place $5 but it might cost in another area $15 if it's even available. Patients either pay out of pocket or sometimes skipping the treatment completely because it's simply too expensive. They bring price stability, better stock and trust into the system. They are turning fragmented pharmacies into a connected, reliable network. They centralize inventory, digitize supply chains and use bulk buying to make medicine cheaper and more affordable. They already have a presence in 9 African countries, reduce medicine prices by 40% and manage over 850 pharmacies across the continent. Where people used to just leave the treatment out because they cannot afford it, they make it more affordable, accessible for the people in need. Now, what happens in the case that you need a doctor but the next clinic or the next doctor is a couple of hours time away from you and you can't access anything nearby? Vula Mobile connects rural health workers directly to specialists via mobile for real-time referrals and clinical advice. Most rural clinics are very isolated, and in case a very special or unique case comes up, it's very difficult for them to treat them. The staff of the local clinic needs to refer the patient because they're not specialized or don't have the know-how to treat cases that are quite unique. Therefore, they often have to refer them without knowing if it maybe was the right decision or not. Vula Mobile enables them to make a better decision, to connect them with the right professionals via mobile without them having to go a couple of hours to see a specialist who might even not be able to help them. And this reduces unnecessary referrals and delays for people who need immediate or the right treatments. Vula Mobile covers over 15 specialists, they are used by over 10,000 healthcare workers and they manage over 50,000 referrals. And they're also saving lives while making decision making easier for the local clinics. These time saving moments can save lives on the other hand, to get the right treatment at the right time with less delays. But what if you cannot access the healthcare system in your area at all? What if you cannot travel or if you cannot afford to travel there to get your treatment in a different place? Checkups Kenya is a business that make mobile clinics come to you. They deploy mobile clinics that bring primary care, screenings and basic diagnostics directly to underserved communities. Many people in rural areas live hours from the next clinic away, and even if they reach, sometimes the specialist could not be there or they don't even have the access to the essential supplies they need for their treatments. They bring the mobile clinics to schools, markets or rural areas to prevent late diagnostics and reduce the missing checkups. They are widely serving the rural areas and have already served over 100,000 patients in over 1,500 different locations across Kenya. Therefore, they are saving lives while simply going to the patients in need instead of letting the patients come to them. Now that we've talked a lot about the physical health, but there's another silent crisis unfolding what's barely talked about, and this is mental health. The business that's helping to solve the mental health crisis is called Mint IT, and they provide an anonymous and affordable localized healthcare platform while offering therapy, peer support, and AI-driven self-assessments. Mental health is often underfunded, misunderstood, and stigmatized. People suffering from depression or PTSD are often dismissed or blamed. The Mint IT is giving the people that suffer from these conditions a place where they can safely talk about it and get the help they need. They have partnered with many licensed African therapists and counselors. They are serving people in languages like Amharic, English, and Swahili, and they have already over 50,000 users across the African continent. Mental health is often a problem that's rarely spoken about because it's stigmatized and people often make it smaller as it is, and therefore this platform gives them access in need and that they get the right help before it's too late or before they are getting too deep into the cycle in their mental health problems. What all of these businesses have in common is that they are fixing broken systems. All of these founders aren't waiting for better roads or better hospitals. They're simply building workarounds. Either if it's delivering the necessary medical supply by drones or boats, or if it's coming to the patients instead of letting the patient travel to the hospitals, or getting online assessments or getting online access to therapy. All of these startups are solving unique problems, and that in a very unique and localized way. And this is the future being built here on the African continent right now. None of these solutions are very flashy, but they're solving the problems that are really need to be solved, saving lives and making things accessible and safer for many people across the continent. Now, which of these 5 startups surprised you the most? Let me know down below in the comments. Also, if you know any other business in your country that's solving something unique. I appreciate you watching. I see you in the next one.